Hello, everybody. Am I unmuted? Okay, welcome. This is Dr. Aida Wen, and I'm a geriatrician with the Department of Geriatric Medicine at JAPSOM. Thank you for joining us for our special series. This is the ECHO Long-Term Services and Supports COVID Preparation Series, and we just want to give a special thanks for our collaborators, which are the Hawaii Emergency Management Agency, the Healthcare Association of Hawaii, Hawaii Association of Directors of Nursing, Hawaii Medical Directors Association, Mountain Pacific Quality Health. And today's webinar will be 30 minutes in length. After a short lecture, we will open the floor to questions. Please use the chat box at this time to submit any questions you may have. And questions that we do not get to, we may include in an FAQ sheet that we will post on our website. We ask you at this time to enter the names of all the attendees in the chat box for attendance purposes. And we apologize for the inconvenience, but we will not be offering CMEs for this activity due to time constraints. But we can offer certificates of attendance to all participants who complete the evaluation. And evaluations can be found on our website under the evaluations tab or by following the link in the chat box. Today's topic is donning and doffing of PPE. And John, if you could just put up the little PowerPoint that we have over here. Yes, okay, so this just went, next slide.
Hold on, let me get that one. It's kind of frozen now.
Oh, okay. Hi, everybody. Okay, yeah, so I just wanted to point out that we put this together very quickly, but we have a number of supporters here, and we have actually on the line, we actually have Patrick Harrison over here as well, and you can wave hello. And Mark Marabella from Mountain Pacific, and Caitlin Cook is out there as well, and she's also available to answer lots of questions, which I'm sure you will have. And we have Eileen Sakato attending as well. She is the president of Hadana here in Hawaii, also available to answer questions. Next slide. And I just wanted to let you know a little bit about the proposed schedule. Actually, we're going to be doing this 3 times a week, Monday, Wednesday, Friday for quite a few sessions. And so I just listed a couple out here. So today's donning and doffing of PPE. We have some of the content, some of the presenters here. Next, this coming Wednesday, we'll be discussing reusing and extending of PPEs. On Friday, proper COVID testing and procedures, and then on Monday again, getting ready for telemedicine. I'm lining up several more topics and speakers, and you'll be able to find them on the website later. Okay, so so what we're going to do right now is we're actually going to do a quick. It's actually a 13-minute demonstration video of donning and doffing of full PPE, and then we'll kind of proceed to other handouts. Okay, so John, if you could put that video on.
Okay, hold on a second. I lost the link. Hold on here.
Yeah, so all of these sessions are going to be recorded. So, so all of your workers and your staff at your facilities will be able to access them later on and be able to have them view them as a refresher as we move ahead. So,
hey, lucky.
Hey, awesome.
So let's go over how to properly don and doff personal protective equipment, PPE. In particular, this is going to be PPE for airborne, droplet, and contact precautions. We'll start off with the donning or putting on procedure, and we'll wrap up with the doffing or removal procedure. But before we get into those procedures, let's talk the basics. What's the equipment that you're going to need to do this, protect yourself properly? The first thing is going to be a gown. You'll also need an N95 face mask. This is going to be for the airborne precautions. If you don't have one, you can use a surgical mask, but just realize this is not going to be for airborne. This will just be for droplet and contact precautions. You'll need a face shield. Alternatively, you can use goggles if that's all you have. And you'll need a pair of gloves. You'll also need an appropriate hand hygiene station with an alcohol-based antibacterial, antiviral solution, a trash bin, and an area where you can put this on and take it off safely. So usually when you have a donning area, it's going to be outside the patient's room or outside the isolation room where you have all your equipment, you have your hand hygiene station, you can put things on safely and take things off safely. Before you start, you also want to think about, well, what do you have on your person? If you have jewelry such as watches, rings, earrings, necklaces, you might want to consider taking those off as they can be nices for infection. If you have long hair, you're going to want to put that hair up. Alternatively, in addition to that, you can wear a hair bonnet. And if you have a beard or facial hair, you're going to need to shave that off so that you can appropriately have a good seal with your N95 mask. So let's move on into the donning procedure. The first thing you need to do, and this is a cornerstone for PPE, is good hand hygiene. And the way I think of hand hygiene is I usually do 2-3 pumps, and it should take about 20 seconds. I start off by rubbing the front of my hand and the back and get really good contact between the 2 palms. And then I move to the back and I go in between my digits with the opposite hand down to the web spaces. And I'll repeat that for the other side. Same thing, really getting in between those fingers. Remember your thumbs now, they stick out, so you want to do those individually by rotating them in the opposite palm for both of them. And then don't forget the tips of your fingers. In order to get the tips of the fingers, I will rub them in a circular fashion in the opposite palm and do the same for the other side. And then I'll finish up by rubbing the rest of that alcohol sanitizer till it's completely dry. And now you have the proper hand hygiene to move forward and start putting on your gear. The first piece of gear we're going to start up is going to be the gown. So gowning up. What I like to do is I like to open it up and I check it for defects, right? Holes, tears, tabs that may be missing that won't allow me to put it on properly. Once I am ensured that it's good, I'll start by putting my sleeves in. This one goes over your head. And you'll notice you have these 2 thumb holes. Those are going to be for right before you put your gloves on. You don't need to do that right at the beginning, but realize that you will need that to get a good seal between the glove and the sleeve. Tie it up in the back. If you have a necktie, you'll do the necktie. This one doesn't have one. It just goes over your head. And then now you're gowned up. The next step is going to be your face mask, so the N95. And when I'm doing the N95, I like to cup it in my hands so that I have my 2 straps here. And what I'll do is I'll put it onto my face and pull that first strap over my head to the crown of my head, right at the top. And the second, the lower strap, I'll pull over. And you want to bring that all the way down to the nape of your neck where you don't have any hair. Make sure that the straps are nice and flush. And now you're ready to mold the mask to your face. This is really important because you need a good seal to protect you from any of those airborne precautions, the viruses that might be aerosolized. The molding process starts at the nose. I push and mold it along my nose. And then what I'll do is I'll move around my face to make sure I have a good solid seal. And this is why you can't have a beard, you'll break that seal. The last part really is checking for any air leaks. And to do that, you'll exhale and feel for air leaks around. If you have any of those, you need to readjust the mask so that you don't have that air coming in and out. And so now you're masked up, you're molded, it's sealed. The next step is going to be the face shield or the goggles. If you're wearing goggles, it's pretty much put them on, put the strap back. These need to go over glasses if you wear eyewear. Typically though, we have face shields. Same thing with this, it has a padding that will go on the forehead. You want to take that strap, put it to the back. You can tighten to make that nice and snug. And the really important part is to make sure that this face shield comes all the way down below that mask, protect you from anything that may be coming in terms of the contact or the aerosolized or the sputum that may be coming from your patient. And finally, it's going to be the gloves. So when I do the gloves, I'll put my thumbs into the sleeve holes, and you just basically put your glove on as you would any old glove. And the key here is to make sure that you pull that glove above the cuff of your sleeve so that there's no skin showing between the glove and your gown. And that's why you have those little rings. It really ensures that you have that length to cover it up. A quick note in terms of the gloves, sometimes people will double glove. That way if they're in with a patient and they have a contaminated pair, either from sputum or bodily fluids, they can quickly remove those and have a clean version. That is not essential. You can by all means do that. But if you do have contamination, realize you can always repeat the hand hygiene with the gloves on. So if these become contaminated, I'll just go back to my hand hygiene so that you've decontaminated these gloves. And now you're basically ready to enter the patient isolation room and do your patient care with proper PPE. Okay, let's go over how to remove or doff your PPE. Before I go through those steps, I do want to talk you through what happens if you're in the patient's room and you get grossly contaminated. First off, say your hands, right? You're going to be using your hands. Let's say you have bodily fluids that have gotten onto your gloves and you need to continue taking care of the patient. By all means, take the time to decontaminate. So what you do would be take a wipe for the gross contamination and remove it off, and repeat your hand hygiene. If you hit double glove, this is a chance to remove that outer layer and again, do hand hygiene. And now you're ready to continue taking care of the patient. You don't have to stop what you're doing. If for some reason the contamination is on your face shield or your mask, don't touch those. Leave those on until you're completely ready to remove all of your PPE and doff it. You shouldn't be readjusting your mask or your face shield while you're in that patient room. That's a high risk kind of setting where you don't want to contaminate anything. They really should stay in place once they're on. But now let's say you are done being in that patient's room or in that isolation room and you're ready to remove the PPE. Most of the removal of everything except your mask is going to happen inside that room, usually at the door where you can throw it away. You may have a decontamination site right outside of that room. That's fine, but just realize you want to keep that mask on until you're outside of the isolation room because the airborne precautions are what this is going to be protecting you from. So you're inside the room and you're ready to doff your equipment by the trash can, or you're in that protected area, you're ready to doff it. The first thing, and this is going to repeat over and over again, is hand hygiene. So I'm gloved. I'm going to do my 20 seconds of hand hygiene. Once that's completed, the first piece of equipment you're going to move is your gown. And this is a disposable gown where you're going to be able to rip it off and pull it off of your body. If it's a cloth gown that goes into laundry, you might have to do either the Velcro strap or do the untying. Just realize that if you are untying, you're going to have to pull this downward to protect yourself and then untie the strap. You don't want to be doing this back here where you contaminate your clothes or your hair, etc. Thankfully, with these disposable ones, they just rip off. So you want to give yourself a hug, and you pull up the shoulders, and you're going to be basically pulling off at the shoulders and waist, and you're keeping your hands in those sleeves. And you roll this gown off of your hands, down to the gloves, and remove the entire thing, including your gloves, with it as a whole entity. Ball it up and throw it in the trash. At this point, remember, we repeat hand hygiene. So repeating the hand hygiene, 20 seconds, good cleaning. Once that's completed, the next step is removing the face shield. There's a couple ways of doing this. You can grab the front of the mask and pull off like this. You can grab from the sides and pull back. I kind of like doing the front aspect, or at least the side aspect. I don't want to be going back here. Again, I don't want to contaminate my hair. So when I remove this, I'll do the side of the front, pull it off away from me, and throw it into the trash. Now, at this point, again, what's the next step? Hand hygiene. Right? You're repeating your hand hygiene between each step, because every time you remove something, they become at risk for contamination. Once I've completed my hand hygiene, I can now either leave that dirty space, either the room or the decontamination site, with my mask on, so then I can remove that in a safe area where there is no risk of aerosolized droplets that may be inhaled when I take this off. Okay, so once you've removed yourself from the isolation room or the patient's room where there's the risk of the aerosolized virus or infectious particles, you can now safely remove your N95 mask or your respirator. And so before you do this step, you're going to want to, again, repeat your hand hygiene, right? Making sure your hands are as clean and decontaminated as possible. This is a 20-second procedure. I'm not going to go through the whole thing again because it's just going to bore you guys to death. But once you have your hand hygiene, you're now ready to remove the mask. What I'll do for this is I'll bend slightly forward, put my head downward, and what I'm going to do is I'm going to grab the lower strap first, pull it over my head, release that strap, and now I'll grab the upper straps here, pull that forward, and you'll have the mask hanging. And then you can just throw it right into the trash can. I'll take this opportunity to remove the hair bonnet, and then you're going to wrap up the doffing procedure with good hand hygiene again, right? So 20 seconds of really making sure you're cleaning your hands to decrease the spread of infection. If there's a sink with soap and water, I'll take this opportunity to use it and really wash myself up to the forearms, etc. And now I'm done. I've protected myself, and I'm ready to move on to caring for the rest of the other patients.
Okay, thank you, John. John, if you could pull up the donning and doffing flyer handout. So these are just handouts that I just posted on the website. That's, yeah, that one, CDC flyer. This is from the CDC, and you could probably just take that and post it up on the walls as instructions for reminders for your staff as they don and doff their PPE. Is it not coming up? Okay. Well, anyway, it's on the website, and anyway, that's the donning and the doffing. It's a one page. One side is the donning, and the back side is the second page is the doffing. And the other thing that I wanted to mention is that there's another item on that I putting on the website as a handout is the doffing checklist. That's from the emergency medicine critical care. They do this all the time, I guess. And so there's a doffing checklist. And so what I wanted to suggest for folks is to, when you have to have a buddy system, to check your procedures as you are doffing your equipment, so that just to make sure that you're not breaking the contamination, because this is a critical element of self-contamination, which can happen if you do not do it correctly. So having a buddy and a checklist to watch as you're doffing the PPE is really important. Okay, the next thing I wanted to pull up, John, if you could pull up the N95 seal check video. This is a short video. Just want to mention that, you know, the N95 does need to have a fit test, and but this part is just the seal check. So every time, even after you do a fit test, you must have you have to do really careful N95 seal test to make sure that it's put on properly each time, so you can actually prevent the droplets and the aerosolization from going in. Okay. In the meantime, while he's getting that link up, I just want to just alert you to also, I posted on the resources, the OSHA National News Release posted on March 14th, 2020, just to let you guys know that there is a change to the N95 fit test waiver. That is a change from a quantitative fit testing method to the qualitative method, so that it's not required to do the full thing, and that OSHA officially have the discretion to not cite the employer for violations of the annual fit testing requirement during this COVID crisis. However, it is still recommended that initial fit tests should be done for each healthcare employee, and that when you do use the N95 mask, you probably should use, you must use the same model, style, and size respirator that you use during your fit testing. So I posted that memo up there for you to refer to and take a look at, just so you would feel comfortable knowing that is the case. John, is there a video yet? Okay, sorry. All right. Also, in the meantime, on the resource list, there is, I actually posted another flyer from NIOSH, which is basically frequently asked questions about N95 seal check. And so this kind of is also a kind of a quick flyer to post up on how people do a seal check on the N95, and that's basically it. But I wanted to mention that under PPE resources for Hawaii, I have a list of N95 certified fit testing locations. There are a number of places like Air Gas Hawaii, Safety Systems of Hawaii, Cintas Hawaii, and some hospitals. And most of these N95 fit testing locations will go to your facility for a fee and a cost for per fit test. You need to schedule an appointment, and you need to supply your own N95 mask, but they can do that. I also have some instructions for general PPE requests going through HHEMC, as well as alternatives for face shields, cloth masks, masks for Hawaii, and gown ideas. So that's just something I wanted to put there as well. John, you want to show the video?
The 3M 1870 is a 3-panel flat-fold particulate respirator and surgical mask. Follow these instructions each time you don your respirator in order to achieve a proper fit. Remove the respirator from its packaging and hold it with straps facing upward. Place the bottom strap under the chin panel next to the warning statement. Fully open the top and bottom panels, bending the nose piece around your thumb at the center of the foam. The strap should separate when the panels are open. Make certain the bottom panel is unfolded and completely open. Place the respirator on your face so that the foam rests on your nose and the bottom panel sits securely under your chin. Pull the top strap over your head and position it high on the back of the head above your ears. While holding the respirator firmly on your face, pull the bottom strap over your head and position it around the neck and below your ears. Make sure the straps are not twisted for increased comfort. Adjust for a comfortable fit by pulling the top panel toward the bridge of your nose and positioning the bottom panel under your chin. Place fingertips from both hands at the top of your nose and mold the nose piece around your nose to achieve a secure seal. Push inward while moving your fingers down the side of the nose piece. Note, always use 2 hands while molding the nose piece. Pinching the nose piece with one hand may result in improper fit and less effective respirator performance. Perform the user seal check each time you don a respirator. To conduct a user seal check, place one or both hands completely over the middle panel, cupping hands over the respirator and covering it as much as possible. Pay careful attention not to disturb the position of the respirator. Inhale and exhale sharply. Be careful not to disturb the position of the respirator. It is important to have a good face to respirator seal. If air leaks around the nose, readjust the nose piece for a more secure seal and repeat the user seal check. If air leaks around the respirator edges, adjust the position on the face and the straps along the sides of the head and repeat the user seal check. Do not enter a respiratory isolation or other hazardous area where respirators are required until you are assured of a proper fit. If you have difficulty achieving a fit, review the respirator user instructions located inside the packaging or refer to the instructions on the 3M 1870 Wear It Right poster to ensure that you are following the correct procedure. If you are still unable to achieve a fit, see your supervisor or a representative from your infection control or employee health and safety departments. Do not enter a hazardous or infectious area. To properly remove the respirator, do not touch the face piece. Slowly lift the bottom strap from around your neck up and over your head while keeping the respirator seated against your face. Lift off the top strap. Carefully remove the respirator without allowing the outside of the respirator to come in contact with your body. And perform hand hygiene. 3M recommends you practice this removal procedure until you are proficient and comfortable with the procedure and before actual use of the respirator for the first time. Leave the hazardous area immediately and replace the respirator if it is damaged, difficult to breathe through, or contaminated with blood or body fluids. Follow your facility's infection control policies and procedures for guidance on how frequently you should replace your respirator. Follow the proper fitting procedures each time you wear the respirator. When in doubt, review the user instructions, including the user seal check instructions. If a proper fit cannot be achieved, do not enter the area requiring respiratory protection. Follow up with your supervisor. Keep in mind that when you are wearing a respirator, it helps reduce potential exposures if the respirator fits you properly. You wear it during all times of exposure, and use of the respirator is under an effective respiratory protection program as required by OSHA 29 CFR 1910.134. Refer to the OSHA website at www.osha.gov for the most current information about use of respirators. Contact your 3M sales representative or call the 3M Healthcare Customer Helpline for information on personal protective equipment, including the respirators described in this training, and to learn more about the other elements of a respiratory protection program.
Okay, thank you. Okay, I'd like to open it up for comments from, Eileen Sakato, Caitlin Cook, or Patrick Harrison, if you guys want to mention anything in particular you want to highlight. Yeah. Please unmute.
This is Caitlin Cook from the Department of Health. I turned my video on for a minute. I don't know if anyone can see me or not, but I know sometimes it's helpful to have a face to the name. So I just want to introduce myself. I don't have really anything specific to add in addition to what was already in the video, but feel free to reach out to me at any time.
And hi, good afternoon. This is Patrick Harrison, Director of Post-Acute Care at the Healthcare Association of Hawaii. Again, nothing really further to add on top of the video that was shared. I will highlight briefly what's happening in a number of other nursing facilities nationwide, and that in inspection surveys which are currently going on right now, where they're seeing a lot of deficiencies is not necessarily in a nursing staff with respect to PPE use and hand hygiene. Rather, it's in a lot of the non-clinical staff, such as housekeeping, facilities management, dietary. So this is also an exceptional opportunity to work with your employees and work with your staff on this to provide additional training.
Okay. And I just want to just highlight really that really being meticulous about hand hygiene, including to the point of having a buddy system to check on you, to make sure, because, you know, we could have all the isolation rooms in the world, but if you don't actually have good hand hygiene or good personal donning and doffing of PPE, it's all a waste of a lot of effort. And so I think that's going to be really critical, and also just to making sure that, as Caitlin actually mentioned in the grand rounds, is that a lot of the contamination happens during the doffing, so you really have to be meticulous about the doffing as well. And I don't know, I kind of like that first video. You can't wash your hands enough, it seems, so that's great. And make sure you go online and look at the handouts. And if you have questions, please do not hesitate to ask us, and we will try to address it in future talks. So this coming Wednesday, we're actually going to be talking about reusing and extending the use of PPEs, and we'll actually be looking at how to doff the PPE, keeping in mind that you're going to reuse it, not actually toss it in the trash. So that part will be addressed in the next at the next session, and we're actually going to be having a guest DON actually from Seattle, Washington, to share with us some very personal and experience from their nursing facilities there. So I think you don't want to miss that as well. So we'll see you this coming Wednesday at 2 o'clock. Thank you.
Thank you.